Hello, everyone. Today I am joined with Dr. Matthew at the Brain Spine Pain Institute of Lake Nona. And Dr. Matthew has some really cool technology to help patients get better he wants to talk about today. Take it away.
Absolutely. So today we're going to run through some of our David programming machines here. Today we're going to talk about these two in particular. These are our neck machines. Okay, and so what's cool about these exercise machines and all the ones that we have here is they are exercise machines. They look like exercise machines, but they're really tailored as far as making sure we get a good assessment on your first day of where your range of motion is and where your strength is, but also using that information to create you a specific exercise program. Okay.
Excellent. And Dr. Matthew, show us how to use these machines and what the benefits of each one is.
Absolutely. So we're going to start here in this corner right here. This is our David Cervical Rotation machine. So that is looking from side to side. So if you ever in a car accident, hurt your neck, have any headaches even, this is a good machine for you, as well as the other one. But specifically, let's say when you're driving and you're trying to look for your blind spot or just trying to look around, this is a good one to help work out and stimulate those muscles into your neck. And then so with all of our David machines, you'll be given a card that helps track your information with the machines as well as use them. And then so I'm going to scan my card right here. And then she's going to change the machine and pull up my program. And then so with this machine, we have people have a seat just like this. These pads go right around your neck just like this. And then a nice and comfortable position. And again, the positioning of this machine is to look from right to left. Okay. And then so on your first day, we have patients sit right into here. And then I scan my card and we tend to run some tests. So if I wanted to run a range of motion test for a patient sitting into this machine here, I would click this button here and it pulls up a degrees kind of log here. Okay. And so with the patient seated down, I can have that patient rotate to the right as much as they can. And then the patient by themselves, they wouldn't have me doing this, would turn their head to the left as much as they can. And as you can see on the screen, it gives you an exact number as far as where your range of motion is. And we collect that data and compare it to normative values of what we expect and want as far as your recovery and your goals for therapy. As well on this machine, with range of motion, you can test strength as well. And then so, essentially, we put your age, height, and weight into here. I put you in a specific testing position. There we are. And let's say I wanted to test the left. I pull up this test here. They would be positioned in here and they would turn their head to the left as high and as hard as they can. And then so it gets a good measurement of where your peak strength is, and it also gives you this black line here. And then so again, we talk about normative values of where we want to be as far as your goals. We have your peak score here, which for this test was about 15.8 Newton meters, which again is just a measurement of torque and power. And then if we look at this black line right over here, this is the normative value or goal for where we want you to be. Okay. And so,
and why is that line important, Dr. Matthew?
And so this line is where we want you to be. So according to research of similar patients of your similar age, height, and weight, this is what's considered normal and functional as far as going throughout your day. Again, for this machine to turn your head, create good posture for your head, and scan your environment, things like that.
I love it. And then lastly, we'll talk about this machine right over here.
Absolutely.
Does a couple different things, and dive into that for us real quickly.
And then so for this machine, this again is another neck machine. This one does a couple of different motions. This is our David Cervical Extension machine as well as Lateral Flexion machine. And then so again, just like the other machine, you get your card, lines up here, has your exercises. You can test the same way with your strength and range of motion on the other side, except this time the motions are, if you wanted to do lateral flexion, you can do left or right, tilting your head to the side, just like this. Or if we wanted to work on cervical extension, we would position you this way and you would push your head back, okay? And then again, using those range of motion measurements that we got on your very first day, we can create a program for you. So if I pulled up the exercise for me to do here, and I position myself for this exercise, you can actually see that we use your range of motion and measurements to tailor you for a specific weight, as well as specific range of motion for the exercise and specific pacing for that same exercise as well. And it's going to give me a really bad score here, but it also gives you a compliance score about how well you did, and then always ask you how easy, medium, or hard the exercise was as well that you can rate. And that will help determine next time you're on the machine, your programming for the next following day.
I love it. Dr. Matthew, thank you so much for showing us these machines.
Absolutely, absolutely. And if you found value in using these machines and feel like it's going to help you toward your pain, please come to the Brain Spine Pain Institute of Lake Nona.